Welcome back, everyone. For those new parents out there, you want to make sure that the babies are sleeping correctly. If you didn't know, there is a correct way for the babies to sleep. And here to talk about that is Tami Gough. She is the Prevention and Health Promotion Services person at Allen County Public Health. Welcome, Tami. I didn't know there was a correct way for a baby, especially a newborn infant, to sleep.
Newborn infants are pretty helpless. So you need to make their sleep environment as safe as you possibly can. And there are some guidelines and an easy ABC to help us remember that. ABCs stand for alone, on their back, and in a crib. All the time. Alone is twofold. Alone means no co-sleeping. Go ahead and have that crib right in the same bedroom with you so you can hear them. You can actually get the little bassinet and put it right beside you so you can actually reach and touch them and feel them and they're right there, but don't have them sleep with you. Alone also means don't have anything in the crib with the baby. Back in my day with my babies, it was how frilly and how pretty can you make the crib, but not anymore. Now you don't put anything in there. No stuffed animals, no pillows, no bumper pads. Some people think you have to have the bumper pads because it's dangerous to have the slats. Well, no, cribs are made in a certain distance with those slats so that a baby can't get their head trapped in there.
Right.
So it's actually safer to not have something that they could get their face pressed against instead of the slats. So nothing in there with them.
Yeah.
On their back, just what it says, lay a baby on their back. This can be a generational thing. A lot of grandmas and aunts and older sisters will tell you, oh no, you have to put that baby on its stomach. You know, they think it helps with colic. They're fearful that if you put a baby on their back, it's going to choke if it should spit up. But actually, the way our windpipe and the way our esophagus are, your windpipe's on top. So if you would have a little spit up, it actually is better to be on your back because then gravity helps it go down the right tube. Oh. So I had to show graphics of that, you know, to convince families of that. And then the C for crib, it means all the time, naps during the night. Unfortunately, in Allen County in years 2022 and 2023, we had 5 infant deaths that were either caused by an unsafe sleep environment or it was a factor in that. And several of those were, I just dropped the baby off at my sister's for a couple hours. And so sister just, you know, put the baby down on the couch to take their nap and the baby rolled. Our program where we distribute safe sleep spaces are actually portable pack and plays. And the reason we choose to do that rather than cribs is that that crib or that pack and play can go everywhere that baby goes. So naps, sleep time, nighttime, every time in the crib.
Wow, fantastic. So a lot of people have probably in the past slept with the baby next to them, but there's an opportunity to roll over.
Yes, absolutely. A lot of people think the baby sleeps better. Sometimes mom thinks she sleeps better because she's not as worried about, you know, what baby's doing because she'll be right there. Sometimes, you know, we love and encourage breastfeeding, but sometimes during breastfeeding, it's easy just to roll right back to sleep while you're after the baby's finished and just, you know, you don't want to get up and put baby back.
Yeah.
But it's very important that it be in its own separate, safe sleep space all the time.
Exactly. So you guys offer walk-ins, right?
We do. We distribute cribs. We get allotted a certain amount from the state of Ohio to give, and it's based on a certain percentage of our Medicaid births in the county. So there are some financial requirements, but if you're on WIC or Medicaid, you qualify. You also need to be at least 32 weeks pregnant or have an infant that's under 1 year. So that way it helps stagger our waiting list to get those cribs.
Is it a certain day to walk in?
We do every Thursday afternoon at the health department from 2 to 4 p.m.
Okay. And then if they want to call and ask any questions, can they just call?
Absolutely. They call our phone number, 419-228-4457, extension 158. And then you can get all your questions answered.
Yeah, and I know there's going to be a lot of questions for those new parents, you know, that are out there. So that's fantastic that you're able to do that for them. So, well, Tami, thank you so much for coming in. I really appreciate it.
Thank you. Great to be here.
All right, well, don't go away because medical news is coming up next.